Hello, my name is Andrew Barry, and I'm currently an assistant professor in medical social sciences at Northwestern University. This paper focused on exploring different ways to support people with multiple chronic conditions in reflecting on how their healthcare relates to their personal values. We did this by designing and testing 3 different paper prototypes to support and structure reflective conversations. Today I'll focus on how the prototypes work and some of the key design guidelines and takeaways from testing them. And I'll leave out lots of details from the findings, so I encourage you to check out the paper. Multiple chronic conditions are a major public health concern, but they're not well supported. A major reason for this is discordance in health priorities between patients and providers. One avenue to concordance in priorities is for patients to be prepared to advocate for their values and priorities with healthcare providers, but patients don't always see how their values relate to their health. So our current research focuses on how to support people in seeing connections between values and health. We're especially interested in how interactive systems can support this reflection and how to balance that with support from human facilitation. Here are a few key concepts to know before we get into the details. We define reflection as a process through which people with MCC gain self-knowledge about their personal values, self-management, and associations among those topics. Personal values are what a person considers important for their well-being and health. Self-management work is done to prevent or attenuate the course of illness complications. And health status indicators are common outcome measures that clinicians use to gauge how well a chronic condition is being managed. In this project, we first generated dozens of ideas for different ways to support this reflection, and then chose the 3 most promising ideas and implemented them as paper-based interactive wireframes. Then we tested those prototypes with 12 people with MCC. The 3 prototypes we chose were MyList, Conversation Canvas, and Time Machine. Before getting into the details of each prototype, it's important to know that we personalize the data in each one for each participant. Participants completed a worksheet on values and self-management work, and then shared their responses in a phone interview, and we added that information to the prototypes. We also got permission to collect health status indicators from their medical record. Another important thing to know is how we approach facilitation. We adopted a flexible approach based on each participant's perspectives and needs. If they got stuck or were unsure about how to use a prototype, we'd step in to help. And we also stepped in to ask probing questions to encourage more reflection. We tested the prototypes with 12 people in 2-hour sessions. This table shows demographics, and this is in the paper as well. The main point here is that we purposefully sampled to hear from a range of identities, including education level, gender identity, and ethnicity. Okay, let's talk about the design of each prototype and what we found from testing with participants. In MyList, the user creates a list of topics to discuss with their doctor and explores how those topics connect to their values, self-care duties, and health status indicators. This short video will show the interactivity of the prototype. After reading a short introduction to the tool, the user creates a new list, enters December 15th as the date of their next visit with Dr. Cooperative, and then they add an item, numbness in their fingers, that they want to talk to their doctor about. They select some related values and self-care duties and health status indicators. For example, related to numbness in fingers is riding my bicycle, checking blood sugars 3 to 4 times per day, and they didn't choose to add any health status indicators as related. Along the way, they also write some reflective comments about how the topics are related, and they can add as many items to the list as they want. So they could also add an item, pain in feet, and associate more values and so on. We found that MyList supported a familiar activity of preparing a list for a visit to the doctor's office, and it enabled people to identify some relationships between values and health. It also produced output that patients could bring to the doctor's office to use as a memory aid and as support to steer the conversation towards their priorities. Unfortunately, with MyList, participants still felt pressure to prioritize their list based on preconceived notions about what was appropriate to share with the doctor, reinforcing existing communication boundaries about values. Conversation Canvas, in this prototype, the user has a guided conversation about their personal values and health with a human facilitator. Both the user and the facilitator can view and manipulate a shared visual conversation canvas. In this video, demonstrating how it works, the user reads a short introduction and then connects with a healthcare worker to facilitate the conversation. And they can choose the type of facilitator they want. Once they connect, the facilitator asks them to choose a conversation topic. In this case, the patient wanted to talk through an important life decision, whether they should move in with their daughter across the state. And then the facilitator guides the participant through the process of choosing values, self-care duties, and health status indicators that are related to that conversation topic. For example, this participant chose family, preparing meals at home, peace at home, and many other items as related to their big life decision. The facilitator added each selected item to the shared canvas, and then probed deeper to understand how those items relate to the conversation topic overall. Throughout this process, both the participant and the facilitator can use items on the canvas to support the discussion. And at the end, the conversation canvas shows groups of items that are related underneath the overall conversation topic. We found that Conversation Canvas created space to reflect deeply about complex topics involving personal values and health. Some participants experienced this as cathartic, while other ones experienced difficult emotions. Externalizing topics on the canvas supported both the patient and the facilitator. And as the conversation closed, a lack of concrete next steps or recommendations left some participants dissatisfied. In Time Machine, the participant reflected on their values today, in the past, and in the future. This video will show how the user starts by choosing items to reflect on today. They rate how they feel about each item and write comments explaining their ratings. And then they repeat that process for a chosen time in the past and an imagined time in the future. As the user builds up a set of ratings on items, they build towards two final screens. So the first one is an information visualization showing how their ratings change over time, and they are invited to take notes about things that they notice so they can identify patterns across time here. The second final screen is one showing items that they thought would change the most and least from the past to today, and then from today into the future. And again, they're invited to write a reflective comment. Time Machine elicited hopeful visions of the future from participants, including some concrete plans for changing behaviors. In contrast, many participants strongly resisted reflecting on the past. And the visualization component of the prototype was not successful. Participants found it very difficult to interpret its meaning. So that was a quick tour of how each prototype worked and a high-level description of what we learned from each prototype. As part of our analysis, we also looked across those findings and generated a set of design guidelines for supporting collaborative reflection on personal values and health. So those guidelines are summarized here. The first two build on strengths of the conversation canvas. So it's important to begin with exploratory conversation around a patient-defined topic and allow the patient to steer the conversation as desired. And second, it's important to map that conversation as it progresses by externalizing key topics and visualizing relationships among them. The third and fourth guidelines build on strengths of the MyList prototype. It's important to conclude with a step to identify takeaways and concrete next steps. So this could be a list of topics to discuss with a doctor at an upcoming visit. And then the fourth, it's important to feed those takeaways into established clinical pathways. So maybe sending those topics to the doctor via a patient portal into the electronic health record. In the paper, we go into more concrete detail about how we imagine combining MyList and Conversation Canvas to build on their strengths and address some of their weaknesses. In addition to the design guidelines, our analysis also clarified two key roles for interactive systems in supporting collaborative reflection on values and health. So those are summarized here. First, interactive systems can serve as personalized repositories of key topics relevant to this reflection. And once established, this repository can act as scaffolding. It can be consulted, selected from, and added to as needed. Second, interactive systems provide a shared information space for patients and facilitators to progressively and collaboratively represent relationships among the patient's values and health. Thank you so much for your attention. Again, there are lots more details in the paper, so please check that out. I'd like to thank Yvette, Lorella, Julian, and Christopher for their support in this project. And I'd also like to thank our reviewers. We got very useful feedback that strengthened this paper considerably. And finally, I'd like to thank the National Library of Medicine for funding this research.